Good evening. Thank each and every one of you all for joining us tonight. Special thanks to Pastor and First Lady and now the members and to our founder, Dr. Wanda Boone. Thank you for giving us this opportunity. Thank you, thank you, thank you. And we're going to go ahead and get started because I do believe in starting on time and ending on time. So we're going to go ahead and get started. All right. Let's talk about COVID-19 booster shot. That is what we're going to focus on. But before we get started with that, we're going to talk about things that are going on now and what has happened before and where we are at this time, because a lot of things has changed in the last 2 or 3 weeks. Okay.
We're not going to jump right into booster shots because we would like to ensure everyone is aware of COVID-19 and the vaccine basics. So here's a brief overview of the COVID-19 infection. The virus SARS-CoV-2 that causes COVID-19 can result in a range of illness from mild symptoms to severe illness and death. We don't know how SARS-CoV-2 will affect each person, but some people, such as adults 65 and older, or people with certain medical conditions, are more likely than others to become severely ill.
And we have seen over the last year and a half or 2 years how COVID-19 has infected a lot of people, and a lot of people lost loved ones and family members. So we just have to just think about that. Think about how many people have COVID-19. Let me see. Just think about that. How many people you know personally in your church, at home, on your jobs, has contacted COVID-19 and are still suffering. A lot of people are still going through the illness. And guess what? It all starts with you. It starts with us. What are we going to do? What can we do? How can we help our brothers and sisters as we continue to get more education about the past viruses and also the new ones that are out tonight?
So while COVID-19 vaccines appear to be highly effective, additional preventive measures remain important to limit the spread of COVID-19. It is highly recommended that we wear a mask that covers both our mouth and nose. And then we avoid close contact with others to stay at least 6 feet apart, which is about 2 arm lengths, and also try your best to avoid crowds and poorly ventilated spaces. I know we have holiday time approaching, but it's very, very important to try your best to limit the amount of people in your home and avoid concerts and things of that nature. It's also very important to wash hands often with soap and water, and remember to use an alcohol-based hand sanitizer with at least 60% alcohol if soap and water are not available, because sometimes when we're mobile there may not be a hand washing station available. So always try to carry you a small alcohol-based hand sanitizer with at least a 60% alcohol. Remember to avoid touching your eyes, nose, and mouth with unwashed hands. I know that it's especially hard during this season when we have our runny noses and runny eyes and things of that nature, but try to remember that, and remember to clean and disinfect frequently touched surfaces daily.
Does anyone have any questions or any comments? Pastor Crouch and First Lady, you and your member, welcome to chime in at any time. At any time.
So you may be thinking, who is eligible to receive the vaccine? Since as Ms. Moore noted, a lot has changed. So COVID-19 vaccines are safe and effective for everyone ages 5 and older. They're now eligible. They're completely free. When it comes to our 5+ years old, that will be the Pfizer vaccine, and that primary series is 2 doses given 3 weeks, 21 days apart. And then the Moderna is 18 years old plus, and 2 doses given 4 weeks, 28 days apart. And then the Johnson & Johnson, 18 years plus, and that is 1 dose. And when it comes to our key facts about COVID-19 vaccination, it's very, very important that everyone get vaccinated. Authorized COVID-19 vaccines can help protect you from COVID-19. You should get a COVID-19 vaccine as soon as you can if you haven't already. Once you are fully vaccinated, you may be able to start doing some of the things that you had stopped doing because of the pandemic.
At this time, we're going to ask our founder and CEO, Together for Resilience Youth, our great leader, Dr. Boone, to take the floor. Thank you.
Thank you. Thank you. So if you could stop sharing your screen.
Okay.
And I will share mine. Well, that sounds cute.
Yeah.
So good evening, everybody. Thank you so much for being here. And I'm going to take a little bit of a different spin because our health is so important. Mental health and our health, our mind and our bodies are connected, in case you didn't notice that. And because they are connected, then we need to pay attention. But Together for Resilient Youth is a coalition of coalitions. We have individuals that are ages 9 to 17 that are part of our youth coalition, college age. We have businesses, faith, law enforcement, community members, health, school, parents, and sadly, parents that have lost children due to overdose. And so we work together in order to make sure that we are on top of things as far as prevention is concerned. You heard from Mrs. Florine Moore and from Keisha Judd, a family team and duo, who are 2 of our community health workers. And I do believe that there are more on the line, but I just want you to know that the success that we have in terms of the numbers of vaccines that we've been able to help people to have, and also the education that we've been able to provide, has been due mostly to our community health workers. So I want to give a shout out to them. So one of the things we need to understand is that COVID-19 cannot survive without a body to live in, and it will not rest until it finds yours. That simply is the truth of the matter. And once it gets into your body, it doesn't want to leave. And I'm going to leave all of that kind of information to Dr. T.R.Y. She's presenting after me. So how many of us have heard this before, to put the mask on yourself before helping others in terms of when you're flying, but it also works in real life. In order for us to be healthy, period, with or without a pandemic, with or without any kind of chronic disease or any kind of illness, it does begin with us. And we need to take care of ourselves. It's okay to take care of yourself. I give you permission to. You have permission to take care of yourself, to exercise self-care. But there's some things that get in the way, and COVID-19 has gotten in the way. So these are some of the symptoms of stress. And you can just look at that. I'm not going to go into these very much, but just know that if you're having nightmares, if you're feeling grief, well, you just find out what you lost in the last 2 years. And in the last 2 years, you've lost the way you used to do things, and things have changed. And we keep looking forward to where, okay, well, maybe it's going to be better next week and I won't have to wear this mask. Now's not the time. Almost 800,000 people in the United States have died due to COVID. If you're having tight muscles, problems sleeping, if you've had hopelessness, injury, hopefully not eating disorders or eating more or less than you are accustomed to. If you find yourself getting angry with others or just wanting to be isolated, those are also signs and symptoms of stress. In addition to those things, if that's not enough, then we need to look at this very busy slide, because the other thing that's happening to us without us maybe even realizing it, and first of all, we need to understand that in some cases, the mind forgets, but the body remembers. On the left-hand side, what you're seeing in the tree are adverse conditions that impact our health. So they're adverse climate experiences. People suffer trauma when there are floods, tornadoes, and even COVID-19 is seen as one of those experiences. Then there are adverse childhood experiences where individuals, again, may not remember, but the trauma is in their body, and trauma does impact the immune system. And what do we need in order to fight off diseases and COVID? We need a healthy immune system. So 10 things that could happen before your 18th birthday are called adverse childhood experiences. And if we want to have another talk about these in particular, we can on another night. But those are abuse, physical abuse, emotional abuse, sexual abuse, neglect, physical or emotional neglect. If there's dysfunction in a household, mental illness, incarcerated relative, mother treated violently, substance use, divorce, and racism is now seen as an ACE. Then the possible outcomes of that, a child experiencing this in adulthood, lack of physical activity, smoking, alcoholism, drug use, missed work, severe obesity, diabetes, depression, suicide attempts, STDs, heart disease, cancer, stroke, COPD, broken bones. So the question may not be, what did you do? The question may be, what happened to you? And so those are things that can affect our immune system, as you see in the middle part of the tree. And then there are adverse community experiences. Always keep in mind that it's not the people, it's the built community. If people are living in communities where there's violence and poverty, if there is poor housing quality or affordability, if there's discrimination, a lack of social connections, economic mobility, if there's a lack of opportunity, then that impacts individuals as well. Down at the bottom, which many people may not realize, except if you're experiencing microaggressions on a daily basis, then you may understand that atrocious cultural experiences are bothersome to you. But did we ever stop to think that these atrocious cultural experiences really do weigh heavily on our physical health? So length of life and quality of life can be looked at in terms of health behaviors, clinical care, social and economic factors, and physical environment. And if we don't have the environments, as you saw earlier when I was talking about the previous slide, then that can actually impact how long you live and the quality of life that you live. Individuals that live in certain zip codes, even here in Durham, are shown to live shorter lives because of where they live. And that is because of what there is access to within that zip code. So it's important to understand that every child, and I believe every adult, needs at least one adult who is irrationally crazy about him or her. So we need to think about this, because if we begin to isolate ourselves based on how we're feeling or the situation with COVID, then we need to be drawn back to those things that can help us to remain stress-free as much as possible. So who or what uplifts you? What or who gives you strength? What or who helps you to get through hard times? And when things get rough, remember that you are not alone. Almost lastly, there's a difference between equality and equity. So even when we think about programs or developing something that can benefit others. Who are we really benefiting? Are we really looking at the whole, the total, the masses of people? So if you think about equality, everybody needs wheels in order to get where they need to go. But a wheelchair is wheels. Someone who's tall has wheels. Kind of designed for the person in mind is the lady on the bicycle, but then the little boy, the bike is too big. So equally everybody has wheels, but do they fit the needs of everybody? Equity means that you design something that will fit the need for the individuals that you want to assist. And that will help us get through that tree when we think about where we live and what we have access to. And really, these are the last few slides. There's something that's called the social determinants of health. Within that tree, we talked about community assets, for example. That means in order to live healthy lives, we need more than go to the doctor. We need more than eat right, especially if there's not the food that you need in order to be healthy in the community that you live in. It's not the people, it's the built environment. So economic stability, education, health and healthcare, neighborhood and built environment, and social and community context. Very quickly, under economic stability, remember the tree again in the community context. These things can actually lead to less healthy lives, less well-being, less hope for the future. Employment, is there employment, food insecurity, housing instability? Under education, language and literacy, early childhood education, high school graduation, enrollment in higher education. Health and healthcare, is there access to health? Is there access to primary care? And then when you get it, do you understand what people are saying, which is health literacy? Built environment, access to foods that support healthy eating patterns. There's some communities that only have fast foods. There are no opportunities for fresh produce. Crime and violence, environmental conditions. Social and community context. This is something that we may not think about, but do you know that many people get their next step in life based on who they know or who they come in contact with, or who even cares or is available to say, well, if you want a job here, I know where you can find it. You may need a little preparation, and let me show you how to get there. That's social cohesion. Civic participation and discrimination. How can we combat that? And then there's also incarceration. So prevent what we can today for a safer tomorrow. One of the things I'd like you to know is that Together for Resilient Youth has programs or initiatives in every bucket of the social determinants of health. And we won't stop until you are as healthy as possible. And I need to put up a mirror to make sure that I'm as healthy as possible too. Thank you so much. That's the end of my presentation, and we will move along.
So much.
Thank you.
We'll kind of just keep the conversation going. And so thank you so much for the opportunity to speak today. I'm Dr. Srinadesh, and I'm one of the assistant program directors at Duke Emergency Department. And I'm joined with my wonderful colleague, Dr. John Purakal, who's one of our attendees as well too, and actually does a lot of research in social determinants of health for our ER populations that are coming in, and really figure out the best way to bridge those disparities of care. And we also wanted to do just a quick shout out to Dr. Ken Kennedy, who's on listening in, but is actually working in the ER itself, who has really been a great advocate for our patients and really wanting to bridge these gaps and provide our community with the best chance of having the life that they deserve. So we'll kind of jump right into this.
All right. Well, good evening, everybody. Thank you for having us. As Dr. Nadesian said, I'm John Purikel, and we have to start off by just saying we have no financial disclosures. No one is paying us to come talk to you all about all of this, and have no backing from Pfizer, Moderna, or anybody else. Okay. So these views are just our own, and we've kind of put these talks together to try and just purely for education, and that's all. So in terms of looking back, this has been a rough 20 months for everybody on this call, right? Everybody's been affected different ways. Our families, how we connect with others, how we work, how we enjoy ourselves, how much time we spend at home versus going out, things like that. And I know Dr. Nadesian, Dr. Kennedy, myself, and all of our colleagues, both at Duke and kind of around the country, have had to change a lot about how we work in the emergency department. We've been dealing with this now for almost 2 full years, and it has changed everything about how we function at work, the amount of risk that we all take. We've seen, an exodus of coworkers who have, left our field to go to work in other fields because of how dangerous it is. So it has definitely, been very challenging in a lot of ways. And I think it's proven that we're all very resilient people, that we all, whether you work in healthcare or not, you found new ways to approach life. You found ways to change how you go about your day to day. And so just give yourself a pat on the back first and foremost, right, for figuring this out. This is all extremely challenging, that every day that there's been a new challenge, a new variant, a new, vaccine update. There's been new things to deal with on top of our regular lives. And so we all deserve to take a moment and just congratulate ourselves that we've made it to this far, and we've learned along the way and we've adapted.
Yeah, I agree, John. I think, sometimes it feels kind of surreal that a virus could really bring kind of the world to its knees, right? And really cause the separation of us from our loved ones, from our patients, for us as doctors. I think back, on the last 20 months, and there's been times that I've felt like the person on the left side of the screen, overwhelmed with sorrow and just not sure what the future holds for my patients, for my family, for my 4 kids at home, right? And not wanting to bring the virus home to them and get them sick. And then there are other times, we feel like superheroes who want to go save the day and really make a difference. But I think, what we hope to do today is really empower all of you. We'll give you the take-home message early is that, one, we're here for you. So if we wanting to create a safe environment for all of you to ask questions and really address some of the concerns that are still out there about COVID itself and also the vaccination, and then really just empower you, because you can help us to really end this pandemic and really control it. But we need a community effort to really be able to do this. And our solution is really just empowering our community and the world with the right information so that we can pass it on.
So very briefly, just going to touch on the history here. The idea of a coronavirus, while the majority of America had never heard of it or talked about it before, 2020, this has been around for a while now. So, it's a very common cause of upper respiratory infection. It commonly occurs in the fall and winter months. And we've had other coronaviruses around prior to COVID. It's just that, some of you may remember SARS being around back in 2003 is when it first kind of really became very popular. And there were, more than 8,000 cases and over 700 deaths related to that from an outbreak in Asia back in February of 2003. And then we had another one called the MERS virus, or Middle Eastern Respiratory Syndrome, that also happened around 2012 as well. So again, not a new virus that we're dealing with. So the research, this is important because the research looking at this virus is not new. We've been doing this for a long time. It just wasn't needed on such a wide scale for so many people so quickly. That was what was different about this virus.
And then, this virus also is a little bit more clever, if you will. What makes a difference is that, this virus is highly transmissible or really contagious is kind of the simple way of saying it. From our mucous membranes and from our eyes, our nose, our mouth, we're spreading this. The other issue is that the incubation period. So it has a longer incubation period. So even before you're getting symptoms, we're already spreading it to other people, right? So this is where it gets really, really dangerous. The prior viruses, like the 2012 strain, actually took 5 to 7 days for it to become maximum infectivity, or the most likely to be spread. But this current coronavirus that we're fighting right now, on day 0, you can be infectious and be spreading it around even before having symptoms. So that's why it's really important to kind of be equipped with the information about getting vaccinated, but also what the symptoms are in case you might develop COVID.
So here, we've seen the numbers, right? Periodic, probably more so back in the early part of the pandemic, everyone was keeping up with the numbers, and now, it's become a way of life. And so sometimes we don't check in on this, but these numbers are staggering, right? 262 million cases around the world, and then more than 48 million here in the United States, with, like Dr. Boone said, almost 800,000 deaths. I mean, these are incredible numbers. We're surpassing every other, major cause of death that's ever happened in our history at this point. And it's almost becoming kind of routine, right? We're forgetting these numbers every single day are so alarming. And so, it is good, even though sometimes it's disheartening to look at these numbers. It is good to remind ourselves how serious this is, right? Because we can forget, we can become complacent, and we can start to, not, the mask can slip down a little bit, or maybe we forget it in the car and, oh, we'll get it next time. You reminding yourselves that people are dying every single day. We're still seeing it in the emergency department every day. It is a good, just a refresher every once in a while to keep yourself on task.
Can I ask a question?
So looking at this, sure.
Now, I don't know if you can go back to that previous slide or not, but of that 48 million, how many of those people that have died have been vaccinated, or do y'all keep those numbers at all?
I can pull that up as well. The numbers are drastically less for those that have been vaccinated. It's a fraction of those that have died that are unvaccinated. And usually the people that end up dying that are vaccinated, and we'll touch on this a little bit more later, but the people that have died that have been vaccinated have usually significant other illnesses as well. They might have a weakened immune system for a lot of reasons. They may have severe respiratory issues, things like that. Okay, but in terms of the numbers, I can try and pull up some exact numbers if you'd like while we're chatting here.
So I guess what I'm looking at is those who are vaccinated, the vaccine does work.
Yeah, so the important thing is
Yeah.
actually, what they found is that the vaccine will prevent severe illness, hospitalizations, and death. So we'll have a slide a little bit later, but when we actually track, especially most recently, now that vaccines have been rolled out for greater than 12, and now in the last month greater than 5, when we look at the patients who are hospitalized, the vast majority of those patients that are hospitalized are unvaccinated patients, and then similarly the ones who have died as well too are unvaccinated.
Yeah. All right. Appreciate it.
Yeah.
So here, just looking a little bit closer to home, state of North Carolina, you can see Wake County there is in a little bit of a shade of blue compared to its green neighbors in the surrounding counties. And so these are just the reported cases in these areas. Mecklenburg County also, higher rate, with Charlotte being there. And so this is, again, we're not the worst in the country by any means, but we do have areas that are still spreading rapidly, right? And we're still having a lot of transmission across the country, and we're seeing these waves kind of come and go. Looking at Durham specifically, again, we have a pretty large caseload here for cases over the last 7 days. You have over 200 cases over the last 7 days, right? And then the average age, 35 years old, and then almost an equal distribution, male to female. So we're seeing, again, just quite a lot of cases in Durham where we work every day. But again, Wake County as well, and more specifically, and I do want to touch on something else. So this is looking at zip codes, right? By zip codes. And you can see here that 27703 is kind of the highest rate for total cases, right? Total number of people that have contracted the virus. But we actually did a study that we're working on publishing right now, going back to what Dr. Boone was mentioning about social determinants of health, looking to see if areas that have higher unmet social needs, all those things that Dr. Boone was talking about, whether it's housing instability, whether it's financial insecurity, it's employment issues, food insecurity, all of those things. What we found is that the areas that had the most unmet social needs, or the highest rates of unmet social needs based on the North Carolina Department of Health and Human Services data, we found that those areas had had a rapid or higher rates of COVID infection. Right. And so we know that these things are all tied in together. This is why they are social determinants of health. They're not necessarily medical issues, right? But they tie into your health and your well-being. And so this map, if you look at, there's little pockets all over the county of Durham that have high needs for social needs, and we're familiar with our community and the areas that you can think of that have higher unmet social needs, right? Maybe that you live in a food desert, or someone that lives in a food desert, and there's not a fresh grocery store anywhere within several miles for fresh food and fresh fruits and vegetables. Those sorts of things play a role, because then you have to go congregate, you have to get on public trans to go get to that grocery store, right? And then you have to be all at the same store shopping, and depending on how strict that store is, higher transmission rates. So again, all of these things are tied together. All of these 3 different talks you've gotten tonight are all tied together.
I definitely want to make this interactive. So if you have questions, please feel free to unmute yourself, or you can use the chat bar as well too, because we definitely want to address your needs and your questions and concerns as well. So please keep those questions and concerns coming. The other main issue is in controlling the spread is that, a lot of the spread can happen asymptomatically. And I know Dr. Pericall and I see this a lot of times. When anyone comes into the ED itself, we're doing a COVID test on that patient, whether they have symptoms or not, just to keep everyone safe, especially, patients who are waiting in the waiting room. We want to make sure that the ones that are in the waiting room, they do not have COVID. So we're keeping everyone nice and safe as you're coming in to have your needs met. So this is from Dr. Anthony Fauci, who actually spoke, during the peak of the pandemic, really talking about, that, up to like 59% at that time could be asymptomatic. And broken down a little bit more, some of those patients were actually pre-symptomatic, like a third of those patients were just in the early phases of developing symptoms, while, a quarter of those patients actually never developed symptoms at all. And so this is where it's really important that, if you're not vaccinated, to really, or you have family members who are not vaccinated, to really encourage them to wear a mask and really encourage them to think about getting vaccinated, because that's the way that we can kind of end this. This is actually from the CDC website, and it really shows kind of the percentage of COVID infections with symptomatic illness. And it also is broken down by age, which I think is really important. The point I want us to kind of focus on is that, kids are doing okay, right? They, it's like a quarter, if you will, that have infections and are symptomatic, but really that the group that's really kind of transmitting this is that 18 to 49 kind of age range. But when you look at hospitalizations and death, it's really our elderly patients that are suffering for this, right? The 65 and older, they have the highest rate of deaths as well. And so this is really where we need to be, good stewards of health and really try to advocate for our elderly, members of our community to really get vaccinated and stuff, so that we can keep them safe as well. We touched base a little bit at the very beginning on this. I won't belabor the point, but the common symptoms of COVID: shortness of breath, coughing, fever, loss of taste and smell, body aches, headache. Those are some of the symptoms that we think about. There are some other symptoms I just want you to be mindful of as well too, like diarrhea. We've had several patients and they've come in with only diarrhea, none of this upper respiratory symptoms, and it is COVID. So it's just being mindful of that. The other part is that, when should you go to the ER? So I know it's scary because, we're taking care of COVID patients in the ER. We actually are very thoughtful in how we're doing that. And by screening our patients, we are able to separate our COVID positive patients from the rest of the patients that are coming in. So I just want to definitely reassure you that we will keep you safe when you're coming in, so that you will not get COVID from that experience itself. And part of that is screening everyone who comes in, wearing masks, which are mandatory. But if you're really having severe symptoms, this is really where you should come into the ER. And that includes like shortness of breath, chest pain, not able to keep down liquids. If you have one of those home pulse ox, or the thing that you put on your finger that detects your oxygen level, if that's dropping less than 92, those are all reasons that you should definitely come in. The other issue is that the disease course itself, it can get worse. So we usually see on day 7 of the disease, 7 to 10, that's when our patients are most likely to get really ill, potentially needing to be put on a ventilator, and need additional medications as well. And I really just wanted to show you kind of this picture that we have on your left side of the screen. That's what a normal lung looks like, nice the kind of dark color that you see in the lung fields itself, this is all nice, healthy lungs. When you look at the one on the right side, you see all that kind of white kind of gunk in there. That's actually kind of the havoc that COVID actually does to the lungs itself and causing the damage. So that's why our patients do have that cough. And we'll talk about the long haulers, the patient who have COVID a little bit, for a prolonged period of time, but the damage takes time to get better. And this is just a CAT scan that really shows, there's very little of that dark black healthy tissue. All of this is kind of white. So it really is, a lot of damage that can take weeks to months to recover. And some patients don't recover at all.
I have a question.
Yeah, sure. Yes, Dr. Wood.
So there are times when people get put on respirators, and are they conscious? I'm just asking these questions. Are they conscious? Are they unconscious? What happens when someone is put on a respirator?
Yeah, so when patients are put on a respirator, they're put on medications to keep them comfortable during that period of time. So typically it's a medicine to keep them asleep so their bodies can rest while we do the breathing for their bodies. And then as we're getting them ready, if they're doing better, which we hope that they will, we'll slowly lighten the sedation or that medicine that they're on so that they can have to do more and more of the breathing to kind of get their lungs trained again, right, to work. And then eventually, if they're doing well, we call it a breathing trial, but we basically have them breathe with the tube in, but we're able to take the tube out if they do really well. So, but while they're on the respirator itself, and when they're really sick, they will be on medications to keep them comfortable.
And I will add to that too, that, generally when we have to put a breathing tube in and put somebody on a ventilator, we do very, very well with most illnesses to be able to get them off that ventilator, be able to get them back, back home eventually, right? The problem with COVID is that at the point that you are getting onto a ventilator is that we do not have a lot of therapies yet that when you're that sick, that will actually reverse things and get you much better. Now, a lot of people do end up getting better and getting off the ventilator, but it is it's a much higher rate of people staying on a ventilator and staying very, very sick with COVID, right? So you never want to get to that point. And there are people that come in who maybe don't attend lectures like this, who don't quite grasp that. They think that, oh, well, this is just a little bit of help for a day or something, and then I'm going to be fine, right? That's not the case. We don't have all of the cures for this. The only thing we have that we know that works is the vaccine to prevent getting it, right? Or to prevent getting the severe COVID. Having a mild case of COVID is still better than being on a ventilator. And so even if you get it and you have a mild case, even with the vaccine, it's better than being in a hospital or on a ventilator. So I just want to make that clear. Normally we do great with putting people on ventilators and getting them off those ventilators. But sometimes, with COVID, it once your lungs are that injured, it's hard to get people back. There's another question, it looks like, from Ms. Crowell.
Yes, hello. I have a question, and I may be jumping ahead because you may be about to speak about it. I don't want to pronounce it wrong. Omicron.
Yep.
Variant. I have received a lot of questions about that. And because there's a rush to get boosters. And so they're trying to ask me, well, how do you know that having the booster is going to help with this particular variant?
So we can talk about it right now since you just brought it up. But every time there's a new variant, so what the vaccines do, and we're going to talk about this briefly, but we're coming up short on time here, so I want to hit on this while we're talking about it. The vaccine provides a blueprint for your body to be able to know its enemy when the virus comes into your system. That's what these vaccines do. With each time that this virus mutates, because we have so many people who aren't vaccinated, so many people that are allowing the virus to kind of keep spreading, your body can mutate the virus. And then the next person that gets it's a slightly different blueprint. So as this keeps happening, when Delta variant hit a couple months ago, right, we found that it's a much faster transmission rate. It was a quicker transmission rate and more transmissible than the previous variants that we were dealing with. Now the Omicron variants come out, we don't have enough data yet to make any big kind of, claims about it just yet, because the first case was just confirmed in California earlier today, in the United States, but it's been spreading kind of throughout Europe and Africa already. It doesn't seem to be much more severe, so that's good, at least from what we know so far. That data could change, that information could change, but the point being, getting boosted is the best protection we have for all of these variants right now. This is the only option we have. Now, the blueprint might be slightly different. So the how effective the booster and the vaccines are may change variant to variant, but it's still going to be better than nothing, than going in without a blueprint, to not know what the enemy, so to speak, looks like, right? And so hopefully that answers your question. The blueprint is going to change a little bit, and our vaccines haven't changed yet, but having something on board so that at least your body has a defense as opposed to nothing is still better.
Yeah, and just to echo that, the virus wants to get smarter, right? It wants to get smarter and stronger so it can keep spreading. That's how it's going to survive. And so if we have something in our body, like an army in our body, which are antibodies that are ready to fight, even if it may not kill it 100%, it's going to do some work so that you will not get severe illness, hospitalized, or die from it, right? So you might get like a very mild, the symptom of COVID, just like the flu symptoms, but at least you won't be hospitalized or on that ventilator where you may not potentially get off of it, right? Or the damage I showed you in the lungs, maybe you'll be preventing all of that until we get the vaccine to be even better and better.
Before we go on to the next question here, there are probably other variants that we just don't even know about floating around, right? That South Africa was courageous enough to actually go and research it and find another variant and kind of come out and tell the world that they had discovered another one. But there are probably other ones going on around the world. It's just that no one has quite yet found them. So rather, all we can worry about right now is doing the best we can with what we have, and what we have are the vaccines. Until newer technology and newer medications come out, this is what we've got, and this is the only defense that we have. Yeah,
then I
we
think
have another
Ms.
question.
Sharon, you had a question?
Yes, I did have a question. It may be a two-part question. You mentioned earlier that some patients don't recover at all. Is this an indication that their lungs are permanently damaged?
Yeah, exactly
Okay.
right. Yep, exactly right. The main place that the COVID virus likes to hit is the lungs, and so there's too much damage to recover.
Okay. Then my other question was, you also mentioned asymptomatic and pre-symptomatic. Can you explain the difference, and are patients as contagious at these states? Because I understand what asymptomatic means, but can you explain the two?
Yeah, so it's essentially like asymptomatic is that you're never going to develop those typical symptoms of COVID, right? Like the fever, the cough, the loss of smell and taste, even while you're spreading the disease. So that's why this disease is spreading rapidly, is that there's a large proportion that are asymptomatic and are still spreading around by not wearing masks, not getting vaccinated, right? The pre-symptomatic are patients who are contagious still. They're still spreading the disease, but they just haven't yet developed the symptoms itself. So it's just like right before the symptoms develop in those patients. And Dr. Farkal, if you wanted to add on to that, but
nope, that's good.
Okay. Thank you.
Yes.
Thank you.
All right. So you might have heard this term long haul COVID or long COVID, right? And so what they found now, because we've actually had now 20 months worth of data and patients to look at, is that there are a lot of folks who have an initial infection, or sometimes they don't even have initial symptoms, but they go on to develop symptoms later. And that's what we call long COVID. So it's anybody who experiences one or more symptoms thought to be associated with COVID, at least or more than 4 weeks after your initial diagnosis. Okay, so this is just, again, another reason, right? Some people are like, oh, it's just a couple days, you'll be sick, and then you get better, and you don't have to get your vaccine, for that reason. This is just another reason, just another example of why getting vaccinated is so important. So 23% of patients with COVID-19, in this study that I'm quoting here, went on to have some symptoms of long haul COVID. So something that lasted more than 4 weeks or came up more than 4 weeks later. And then 19% of the patients that had or of asymptomatic COVID patients had long haul COVID, meaning you didn't even have initial symptoms, right? You got tested, you found out you were positive, maybe because you were exposed to somebody else. And then you went on to have symptoms later, right? And pain, breathing difficulties, fatigue, that list of 5 things, that's what they found most common. But literally any of the symptoms that are associated with COVID, you can have long-term. And so these are things that we don't want any of our patients to have to deal with. We get people who come in and say, something's not right. My symptoms are, I shouldn't be having COVID symptoms this long after. It's like, we're seeing more and more that this is the case, right? And so again, what we're trying to do is we're not trying to scare anybody, and we're not trying to, the goal here is that we know that by talking to our patients, we know that the best form of education that outside of getting these sorts of talks is having you all go out and tell your loved ones and tell your friends and communicate with others within the community, right? A lot of times patients come in and they just don't know because they haven't heard about these things and they don't know why it's so important, and they don't have access to a talk like this, or they don't have access to, a primary care doctor. So having you all go out and be our advocates for this type of information is really, really important. All right.
Do you have another question by chance?
Oh.
I saw your hand was up still. No, okay. So we wanted to just kind of change gears and just talk a little bit about vaccinations, and then kind of give, some of the common concerns that we hear in the ER from our patients and stuff, and just kind of address some of the information and really equip you with that. And luckily, now the vaccine is available for ages 5 and above. So it really is a big step in getting, the majority of the population vaccinated. So we really need to be thoughtful about, spreading the information and helping everyone, get their shot at freedom again, right? By getting the vaccination.
All right. So common myth number 1, or concern number 1, I don't want to be a guinea pig. The vaccine is too new, right? The process to develop it was too quick. So again, going back to what I mentioned earlier, we've known about this virus for a long time, and scientists have been working on cures for coronaviruses for a long time. This isn't necessarily new. Now we've got, millions and millions of people. I think roughly 60% of the United States now is fully vaccinated, right? So it's not necessarily a guinea pig anymore. Okay, I mean that excuse doesn't really fly. We know that the risks for vaccination are exceedingly low, all of them really less than 1%, besides the very mild initial symptoms that you may have from a vaccine. But any serious risks are extremely low, less than 1% across the board, and even fractions of 1% for more serious side effects. And we know that getting COVID, the risks of all of those kind of bad outcomes are much, much higher, right? So we don't want to, it's a numbers game. And if you know the numbers, getting the vaccine is the smart choice. So again, these are some of the things that we talked about. Scientists have been working on this for a long time. It's not new medicine for them. And so all of this mRNA vaccines, you might hear that this is new and this isn't developed. That's not true. A lot of the researchers have been working on this for a decade. And then just so happened they had to change the blueprint again, right, to adapt it to this particular virus. But the idea and the concepts were all the same. So here in terms of the phases for, and I don't want to belabor this too much, but normally these phases that you see here are spread out over a few years for a clinical trial, right? But because people were dying so fast and so many people were dying, they had to modify this timeline and make it shorter. But what we found now, because we've had months and months of real life data, is that the data from the initial studies looking at all of this held up, and that we aren't seeing these, a lot of bad reactions, especially for Pfizer and Moderna. There's a concern for with Johnson & Johnson. There's one that comes up pretty frequently, so I'll mention it, in that there's been 6 confirmed deaths out of, again, millions of people related to blood clots, and that people have had blood clot side effects with that. Again, it's a small percentage by comparison, but it is something worth mentioning. I don't want you to think that everything is, there's no side effects at all. There are, but we know that the risk of getting COVID, especially if you're elderly, especially if you have other medical illnesses, is much, much higher. And then all of these vaccines have gone through vigorous testing. We know that the vaccines are across the board greater than 90%, and Moderna and Pfizer specifically 95% effective in preventing COVID-19. And even if you look at these new variants, even some of the early data saying greater than 80%, 85% effective, against all of these new variants. So very, very reassuring and helping to prevent hospitalizations, helping to prevent deaths, right? These are the things that we really worry about. We're not worried about the mild cold or the mild flu-like symptoms. We're worried about the severe illness.
Mhm. Yep. And another concern that we've seen, is, our patients may say, like, I've heard that the vaccine may alter, my genetic makeup or have a tracer or microchip that's implanted in it, or even concerns about fertility, that it actually hinders fertility. And I think, Dr. Protocol actually touched base on this a lot earlier, so I won't belabor the point, but really giving our bodies a marker, right? A small mRNA like protein that can really help it say, like, hey, this is an enemy. I'm going to make antibodies, and then I'm just going to wait, right? Wait so that if the body ever gets infected with the true COVID virus, it'll be ready to fight, right? Fight the fight for your body so that your lungs don't get damaged, so that you can actually have either no symptoms at all or very mild symptoms, right? That's why the vaccine is really important. Regarding the concerns about privacy, it's really important that there is no microchip in here. I think that's a common concern, that there's no tracing device. There's actually no personal information that's kind of being gathered as well too. And also we give vaccines all throughout, CVS, Walgreens, it's widely available, but that information is not, shared with other people. The other thing that was a concern was fertility. So the COVID vaccine will not actually affect fertility. And I think this is really important, because if you remember that 18 to 30s range is the group that's really spreading the disease. And that's the childbearing age as well too. So it's really important to recognize that the vaccine itself, although the proteins are similar to a protein that's on the placenta that gives the baby the nutrients that they need, there's been no confirmation that it actually causes a cross reactivity or causes the woman, the mother, to lose the baby at all. So that is actually a misinformation. And this last bullet is the most important. All of our kind of governing important bodies, like ACOG is the American College of OBGYNs. We have the Society of Maternal Fetal Medicine, even the American Society of Reproductive Medicine. They all tell our reproductive patients who want to get pregnant or who are pregnant to get vaccinated, right? So to have these groups that specialize in pregnancy say, get vaccinated, it's really important. And the reason is this. If you're pregnant and you get COVID, symptomatic COVID, there's a 70% increased risk of death, right? And that is astounding. That's really terrifying. My twin sister actually is pregnant. And so we talk about this quite a bit, is just try to keep her safe, because even though she's vaccinated, this gets a little bit scary to really understand. And the other sad part is only 31% of pregnant patients have been vaccinated against COVID. So if you know someone who is pregnant, really share this with them so they can really understand that there's a lot of risk if you get COVID during pregnancy, including, poor outcomes for mom, but also like preterm births and babies being admitted to the ICU as well. So it's really important to get vaccinated.
All right, concern number 3. I've heard the vaccine may give me COVID. I may die from the vaccine. It won't work against new variants. All of these have been proven false, right? The vaccine does not give you COVID. We've talked about this. It provides your body with the blueprint to recognize these little blue spikes you see on this image on the right here. These spike proteins on each new variant, these are slightly different. And so even on this new Omicron variant, here we go, they're labeled spike proteins here you see on the left. This Omicron variant has 37 mutations of this specific blue spike protein, right? But it's your body is, when you get the vaccine, your body is getting the blueprint to how to create antibodies, like Dr. Nadesian was saying, to attack those specific proteins, right? And so, yes, the effectivity of the vaccine may change slightly with each of these new variants, but having some defense in your body for when this happens is still 1000% more important than if you have nothing. The other thing that's mentioned in there is the idea that the COVID vaccine can cause people to die, or that people who get the vaccine die shortly afterwards. There have been 459 million shots given of the vaccine. Okay, of that, 99.9978% of people. Okay, so almost 100%, but 99.9978% of people have not died. And the very small fraction of a percentile that have, they have never confirmed any link to the vaccine. A lot of those people have other medical issues going on that ended up passing away, presumably because of a lot of other things that could have happened, but they have not found any link between those deaths. And they go in and look at all of these deaths when they happen, and they review the reports afterwards to see if there's any linkage. And then, and again, some, just kind of to keep things moving here. After you get your vaccine, for those of you that haven't gotten it, you will get some very mild side effects, most commonly some pain at the site where the injection is. About 24 to 48 hours later, usually that's completely gone, okay? You may see a little bit of swelling in that area, and then you may have just very mild flu symptoms, okay? And that varies. Some people will feel like it's a pretty significant flu for a day or two, but most people have no symptoms related to the flu or very mild symptoms. Occasionally you'll get a person here and there that has a more, kind of feel run down for 2 or 3 days, but then after that it goes away. And then they have a tracking system as well, this V-Safe tracking system there you can log your symptoms, and this is how we have all the data that we have across the country.
I think, because we have 5 minutes left, we just want to be respectful of time. Just if there's any kind of lingering questions, we can definitely will share a slide deck so that there are just 2 other concerns. One is like already having COVID and being young, but still the recommendation is that you should still get the COVID vaccine. If you had COVID, it's typically 90 days afterwards that you should get vaccinated, but you should still get vaccinated against COVID itself. And the reason why is that the patients with comorbidities, so lung disease, diabetes, and all the rest are the ones to get sick. And really to prevent our patient, ourselves from getting sick, we need to have all of these things in place so that the virus cannot get through. So the Swiss cheese model. But in just the last couple of minutes, is there any questions that we can kind of answer? And I'm just going to stop sharing screen just so we can open it up for any lingering questions.
Yes, ma'am. I do have a question. So I have my daughter, she'll be 5 at the end of December. I just wanted to, I'm not skeptical about it because I'm fully vaccinated and I'm glad that she's turning 5 and she'll be able to get vaccinated. But is the vaccination in like Pfizer, Moderna, does everyone have the vaccine for the 5-year-olds?
No. Oh, go ahead, Sri. You can.
Yeah, it's the Pfizer is the one that is approved for 5-year-olds and above. But the other 2 are for 18-year-olds and above. So Pfizer is the one that is the one that 5 plus will be getting. Yeah.
Okay. And as far as boosters go, I know your booster is the one that you originally got, correct?
It doesn't have to be. They've allowed it that you can actually mix if it's more convenient, or if you'd want to, you can, if you've got Pfizer for your initial first 2 shots, then when you go in to get your booster, you can get Moderna or vice versa.
Okay.
They haven't found any reason to not do that, and they're going to look and they're also going to look and see how effective mixing it is, but they haven't seen any negative or bad outcomes from people doing that.
So he got his booster yesterday, and he got Moderna, but he got Pfizer for the first 2. So it's just availability at the pharmacies.
Okay. And also, is it true that you have to wait 6 months to get the booster?
Yes,
Yeah.
that is.
Okay.
Yeah, that's the current guidelines. And again, it makes sense, right? We think about things like the flu shot. It's your body's that your body goes through that immunity, and then each year you just need kind of a your body needs almost like a pick-me-up, like to reboost your immune system back up and to be ready for it again. And so that's why we recommend getting the flu shot every year, especially for people that are high risk. And then same goes for this. I think this is for the time being until we have a cure on the horizon or something like that. We have to get used to the idea that this isn't going anywhere and that we have to adapt to life with it. And the ways to do that are to have a good defense, right? Have your defense set up, have your do all the right things, be responsible, wash your hands, social distance, all of those things. But again, the one thing that we have that actually helps us to prevent this right now that's approved is the vaccine. And so that's the key, that we need all of you to go out into your communities and your families and your households and kind of share this with everyone who isn't vaccinated already or who's on the fence, because we know that people who are on the fence, it's not because not all of them are hard-headed and just don't want to hear about it. It's just that they haven't been told about it the right way, right? And so we want to make sure that everyone has access to the same education, the same information, equity, right? It's about equity, figuring out what that person needs, right? Which wheel fits for that person, and not just saying it's a one-size-fits-all type of solution.
Okay. And my last question is it 6 months from the first shot or 6 months from the second shot?
Shot. Yeah.
I think it's second shot, right?
Yeah.
Yep, I think it's a second shot.
Okay.
I have a question.
Go ahead.
My question is, how is it that you can really distinguish COVID from pneumonia when a person is coughing, spitting up blood, and running a high fever?
Yeah, that's where it gets tricky. I think with COVID being as rampant as it is in our society, it's best to get tested if you're having those symptoms, even like sneezing, feeling like you have allergies and stuff. That can still be COVID. Those are some of the mild symptoms of COVID. So the first step is definitely getting tested for COVID, and then also just getting checked out by your doctor. So if you're feeling really sick, potentially getting a chest X-ray as well, getting your vital signs to make sure your oxygen level is not low. All of those things are important just to make sure that you're feeling okay.
Oh, okay. Thank you.
There's a question.
Yep, I was just going to answer that. Yeah, that is fairly common to see. So the question is it common to get swollen lymph nodes after the COVID-19 vaccine? It is common to get that. And again, that's your lymph nodes are where your body, they're the powerhouse of the immune system, right? And they kind of help us to, when you get sick, your lymph nodes tend to swell up. Similarly, in this case, the vaccine is your body's preparing for illness, right? It's getting ready to have that immune system boosted. And so we do see that. We've even seen some folks who have swollen lymph nodes for quite a while afterwards. And that's actually not uncommon either. Now, if it becomes very painful, or if you start to think that it's infected or something like that, that's a very different story. But in general, we do see some swelling of the lymph nodes is very common after getting the vaccine.
I think Camilla had Ms. Faust, I think you had a question.
Do we have anyone else who has a question?
See, Camilla Faust has her hand up.
Yes.
I'm sorry, I forgot it. I just want to ask a question. I had got the booster shot today, and why is it? I'm getting the side effects. How long do they normally last?
24 to 48 hours. Yeah.
Yeah. I would say from personal experience, mine, from when the symptoms started to when they were gone, usually by 48 hours after that, 36, 48 hours, something like that is by, the majority of them were completely gone. And with my boost, my second shot, I actually had a pretty good, high fever and was in bed for a day. I didn't have that with my first shot, and I didn't have it with my booster. So it just varies person to person, the response you're going to get. But just know that it's expected. It's okay. It's going to get better. And if it doesn't, that's when you come in and see us.
Yeah, but definitely you could take like Tylenol and Motrin to kind of help you with those symptoms as well. Actually, my husband was having some chills when I left the house today as well too. And I was like, here, take some Motrin, you'll be fine, right? Your immune system's working, right? So that's a good thing. I was like, I'm glad you're having symptoms, because now I know your vaccine is kicking in and your immune system's going to be ready in case he gets COVID, later on. So it is a positive sign. It's just take some Motrin and drink lots of water and stay hydrated and get some rest too.
Okay. All right. Thank you.
Do we have any more questions? Pastor Couch, are you okay?
Yeah, I was just sitting thinking at the current time, we require, the church is open and we require everybody to come in to wear a mask. I think in the beginning, I heard that whether you've been vaccinated or not, you still should still wear a mask. Is that correct? And I know I got two doctors, if they tell me, yeah, that's what we're going to continue to do.
Yes, I would definitely recommend that, especially because it's an indoor, I'm assuming your services are all indoors, at least especially now with the weather, that's definitely risk. It'd be very, very risky to start to be lax with that now, because especially if you're not checking people's statuses and things like that, it's hard to kind of stay on top of all of that. The easy thing to do is just still keep it a blanket. Everyone has to wear a mask, indoors, as part of your service. You get outdoors, people can take their masks off and social distance and do all the things they're supposed to do. But for now, until they change the guidelines, which I don't know that they're going to for the indoor events anytime soon, it should be masks for everybody.
Well, let me ask a question. Is it good to have in-person services now, or should that be something that we really should take into consideration?
So that's a very tricky question, and Sri, if you want to
jump
in at any point, but
yeah, it's a challenge. I think the guidelines are a little bit, definitely if you check on the CDC website, they talk about like wearing a mask indoor, specifically because, high crowds and not knowing the vaccination status of your group, right? It's how the virus can spread. And especially because it could be asymptomatic. You have people in your congregation who don't have symptoms, who are not vaccinated, who are coming in. Now we're spreading it. And then also our elderly, community members are there too. They're the ones at risk of getting it and really getting sick from it. So it's really being mindful of how can we advocate for our community members. So keeping a mask on, social distancing if you're able to, all of that is really important. And also having people wear their mask properly is the other part, right? Is over the nose and the mouth, because we see a lot of times it's just over the mouth. Remember, it's spread through the mucous membrane. So the eyes, but definitely the nose, because we breathe through our nose. It's important to make sure everyone's wearing the mask correctly as well, because that's a common thing that I think Dr. Furcal and I see is they're like, I don't know how I got COVID. It's like, well, it's over your mouth or it's not really on your mouth. It's we're wearing it on the chin. That's not going to provide protection.
Yeah, and if in-person services are an absolute, right, if we have to do that, and I recognize it's very challenging to get people as engaged virtually, whether it's because of access to a computer or because of just not being face to face with folks. Limiting maybe the number of people is another strategy that I've heard a lot of congregations using, so that you have a little bit more space between folks in the pews. That's another option as well, just to try and what you'd hate to have happen is find out that there was an outbreak from one of your services, right? And so that's why we want you to try and have all the options to make sure your congregation is as safe as they can be. But I think limiting the number of people at each service, wearing the masks through the whole service, things like that are going to be the ways to keep everybody safe, and then still hold in-person congregations if that's what the group has chosen to do.
All right, thank you.
Do we have any other questions?
Yeah, quickly, because she mentioned the mask in church service. So when you have a group of people in a closed environment, are cloth masks recommended? Are they just as good as the other ones, or do you prefer them not to use the cloth mask under those circumstances?
I think, it's a little bit challenging. I think in general, as long as there is a mask that's worn over the nose and mouth, I think that is the general consensus, is that's going to, and everyone is doing that, right? So it's not just one person, then the person next to them does not have a mask on, right? So if everyone's wearing a mask, that helps the prevention of the spread of the germs as you're talking and singing and all the rest.
Yeah, I think that the hospital grade masks, or that, any masks that have like a kind of a filter to them, are better than a cloth mask. And then if you can get, they're a little bit harder to get and they're more expensive too, any sort of KN95 or N95, it's a risk reduction. It's an issue about risk reduction, right? Nothing you're going to do when you're around other people is without risk. In this situation, it's about what are the things that are going to reduce the risk the most. So, if you're somebody who's young and otherwise healthy, a cloth mask is probably fine, right? But from a risk standpoint, because the risk of you actually getting a severe illness is not as high. But if you're somebody who's got a weakened immune system, has any risk factors that we were talking about before, I would be very, very careful about, number one, what mask you choose, making sure you have an appropriate mask and a well-fitting mask over your nose and mouth. But even attending services in person, right? Those are things that are it is risky to have any indoor. I mean, this is actually segueing to something else that we wanted to talk about. We didn't get into, but getting together for the holidays. That's something that we, everyone's going to be thinking about moving into the next month here. If you haven't already for Thanksgiving. It's going, take every precaution, right? Especially around folks who are older, who have medical problems, who have weakened immune systems, or people that are not vaccinated. Whether it's getting tests ahead of time, trying to stay separated within the house. With the weather the way it is, you probably can't do a lot outdoors. So then you become very limited if you're not in a very ventilated, space. And so this is when we see the peaks. This is when we saw last year. We saw the numbers go up drastically, right? It was the week and 2 weeks after Thanksgiving, and then again right after Christmas. So just be careful out there. We know it's hard to not get together for the holidays, and we all want to do it. But it's just, this is how it spreads, is in these close gatherings, not ventilated spaces, eating, right? You're taking the mask off, you're eating food together, you're sharing food and drink. Those are things that put you at much higher risk. So just be smart and be careful about how you do it.
A question. A lot of companies are pushing the air purification machine. Are you all familiar with those? They say they're supposed to help stop the virus.
Yeah, we use them in the emergency department. We use kind of the hospital grade ones in the emergency department. As far as recommending other folks get those that aren't if you're, for example, a church having them in an open church, then that's definitely not a bad idea to help, but it doesn't take away the need for any of the other things we're talking about. Okay. That's that Swiss cheese model that Dr. Nadejan was talking about, is that, everything helps a certain amount, but everything isn't perfect. And if you have enough of those things going on at once, you're going to have a better defense for this than nothing at all. Okay.
And so even with the filter, you would still be wearing a mask. You'd still have your family wearing a mask. You still would not be, ideally not eating together, which is really challenging because the holidays are all about eating, right? And so it gets really, really challenging, but just don't be reassured that filter is going to keep you safer, right? Especially if you're not doing those other things, especially because if your family members who are coming over are not vaccinated, that's definitely a higher risk situation as well.
Dr. Boone, do you have anything else you would like to share or say?
I don't have anything else or say. I'm just really, really happy and thankful for this presentation and for Pastor Couch allowing us to be here tonight. And this presentation is recorded, so I'll make sure that folks have a copy. And there were people that contacted me from Canada that are looking forward to having a copy of this. So thanks so much. And it's up to you, Mrs. Moore.
Thank you all so much. Thank you for the great session. And we do appreciate Dr. Boone for allowing us to do this.